So in kids, there's the physical symptoms, okay, that look fairly similar to symptoms in other anxiety disorders. When they are presented with the situation, you will see things like increased heart rate, or sweating, or trembling, or shortness of breath. Kids saying, I feel like I'm going to die, or I feel like I'm going crazy. These are the physical symptoms that will go along with the phobia. You're also going to see most likely a really intense avoidance of whatever the phobia is, the object of the phobia. So the kid who won't go near the dog or won't even go outside because they're afraid that they may see a dog. Or you're going to see a very, very high level of anticipatory anxiety. That is that the child will start to worry, talk about, develop symptoms of anxiety in advance of actually being in the situation. Or at times, and it's less common, but we will also see kids who are able to face the object or whatever the feared stimuli is, but they're doing it with such a high level of anxiety that their normal routines and functioning are interrupted. It's really important to remember that having fears is also a normal part of childhood. Kids get afraid of the boogeyman. They get afraid of the dark. They don't want to go to the doctor and get a shot. But there's a real difference between sort of these transient childhood fears and a phobia. And, the distinction is really in the intensity of the anxiety, the duration, how long it lasts. In order to get the clinical definition of a diagnosis of a phobia, it needs to be persistent for 6 months or longer. And also in the interference of functioning. How much does it impact the child's life at home or at school or relationships with friends or family or with their activities or extracurriculars?